I'm Nadia Bilchik, and I'm joined today by Dr. Jeff Puglisi. And Jeff is a concierge internal medicine doctor in Greenwich, Connecticut. And Jeff, a very warm welcome to Nadia Bilchik TV. And I always say today, Nadia speaks to a very esteemed physician. In fact, just to tell you this, that 3 years in a row, am I correct in saying this? Or Jeff
it's over the last 5 years, right?
In the last 5 years, Jeff has been nominated, considered one of the top 25 top concierge doctors in America. So your time is very precious, and I will make very good use of it.
Thank you, Nadia.
So, Jeff, let's start off with, you're in Greenwich, Connecticut.
Right.
It's just outside of New York amidst the COVID crisis.
Sure.
What has it been like for you as a physician dealing with this?
Well, I'll start in a couple of different scenarios here because I have a background at Mount Sinai Hospital in the city. That's where I trained 20 years ago. A third of my career there was spent at Elmhurst Hospital. Many people have seen that on the news. It's kind of the epicenter of where this originated and where we really saw a lot of the patients getting so sick and the doctors getting overworked and overrun. So I have a feeling of kinship, if you will, to those physicians down there. Secondly, I have a mother who's been a mayor or supervisor of the town that is about 30 minutes from here in northern Westchester. And she and I have been talking about this for many, many months because we knew this was coming. And so I see it not only from the physician side, but I also see it from the side of local leaders. Then I truly believe that the politicians, both from a federal level and from a local level, are saving more lives than any one physician can. And I've said that loudly and clearly to her, and she and her town board have done so much to help their residents. But in terms of what I'm seeing here in Greenwich, I see a lot of scared patients. That's what I see. And I see physicians that are trying their best to not only protect their patients, but to educate them as to what symptoms to watch for, and then what treatments are available, and how one day we might be able to get back to a degree of normalcy.
Okay, so let's start with this. There's so much information out there. There's so much confusion out there. Dr. Puglisi, for you, what are the symptoms? What should we who are staying at home, when do we know that we have to take this seriously? Or what are the warning signals for us?
It's the most important question we have to ask all of us at the moment. What symptoms do we have to watch for? When do I reach out to my physician? Because the fear can sometimes paralyze us to understand what may or may not be real symptoms versus somatic symptoms that are coming from the stress and anxiety of it. The classic symptoms are fatigability, fever, dry cough, sore throat, nasal congestion. We've seen more stomach issues, nausea, vomiting, and diarrhea than I expected to. But there's a new cascade of symptoms that we're finding that I'm not sure we truly knew coming out of the initial epidemic in China, that is more of a neurologic cascade of symptoms. And that's something that I've talked with a lot of local neurologists with, my partners. I have 3 other partners here in my practice, Dr. Shea, Dr. Cipriani, and Dr. Mickley. We've all talked about this amongst ourselves.
And what are those symptoms?
Headache, severe headache, ringing in the ears, loss of sense of smell, loss of sense of taste. Sometimes in our older population, mental status changes, which can lead to dizziness, vertigo, balance issues, falling. I had one patient with severe fatigue and he fell. And that's what led me down the line of testing him for COVID and ultimately hospitalizing him. But those neurologic symptoms, along with what I'm finding, Nadia, is a severe, almost a significant anxiety and or depression, almost a feeling of despair, if you will, when patients have this symptomatology. I'll give you a quick example. I have a patient of mine that has what I consider to be moderate symptoms, but has unbelievable fear, unbelievable anxiety, and almost this I don't want to go on feeling. And I think that that is above and beyond what we expect. So I truly believe in the coming weeks to months, and I'm hopeful of this, that scientists and neurologists will figure out really what's going on at the level of the brain using EEG monitors to screen for seizures, look at MRI perhaps, and add to what we know about the pulmonary prospects of this disease and understand that maybe if we're treating more of the neurologic symptoms, it might open up an ability to decrease how sick people truly are getting.
So, Dr. Puglisi, this is such important information because you may not experience all of the symptoms. So,
Right.
for example, and I was telling you yesterday when we spoke, my husband didn't have a fever at all,
Right.
no fever. And yet he's tested positive. And the reason he didn't want to go for a test was he said, I don't have a fever. And
Right.
I urged him. I said, Steve, you're coughing. This is what you're doing. So I think there's so much misinformation out there. And these kind of conversations are so critical because no, he didn't have a fever, but he was coughing. So you might have one or some.
Absolutely. And I think that that's why people have to just have an open conversation with their physician. Try not to diagnose yourself. All of us don't want to have the virus. All of us are fearful of getting it. There's a part of us that doesn't even want to know. And I think when we fight against that and understand that knowledge is power, education is power, knowing what you have not only helps you, but in this specific pandemic, it helps everyone else around you, both in your home, in your workplace, in the future, etc. So take those symptoms seriously. What's the harm of picking up the phone and speaking to your physician and asking him or her if this could or couldn't be related to COVID? It does not have to happen altogether.
Yes, but there was a time where if you didn't have a fever, you couldn't get tested. So I remember a while back, there was some testing going on in Georgia. My husband went and said, but I don't have a fever. They said, then we're not going to test you.
Right.
So what you're saying is you can, in fact, be COVID positive or carry and not have a fever. That's huge.
Absolutely. When we saw the data initially, 90% of people coming out of Asia had fevers with this, some subjective sense of fever or actual temperature elevation. I'm sorry, that's not what I'm seeing. What I'm seeing are the more subtle symptoms that are happening, and perhaps we're seeing it at the beginning of the disease, of the infection, and we really have to have our radar up in terms of these symptoms and be mindful that patients don't present as if they were coming out of a textbook. You have to have your mind open to the possibilities that subtle symptoms could indicate the disease, because quite frankly, the more people we diagnose, the better we understand the prevalence of this condition, and then we can make better decisions from the local and state and federal level as to when we open up.
Yes, but one of the biggest complaints is the shortage of testing. So you're in Greenwich, Connecticut.
Right.
A patient calls you or comes in. I'm curious to know, are you seeing people in person or via Zoom?
We see nobody usually in the office because we've done a lot to protect ourselves and our staff. We don't want to be sitting on the sidelines watching this from our homes. We want to be here on the front lines. And
okay, so a patient presents, calls you.
Calls me, emails me.
How do you get them tested?
For instance, a patient called me today and said, Jeff, I'm having some difficulty with chest pain and shortness of breath. It's probably my anxiety. What do you think? We had a 10-minute conversation about it. I had her check her vital signs, which was helpful. And then I said, you know what? You're coming over here and we're giving a test and we're doing a swab.
And you have tests available at your office in Greenwich, Connecticut. If people are watching this, they can come to you and get a test. Very limited,
Very limited swabs. I only have about 15 swabs at the moment left, and we're hoping to try to get more. And that's really been putting us to test only those patients that are symptomatic. In my opinion, and the opinion of the doctors here, is that we would love to open up the testing for asymptomatic patients to understand the prevalence so that we know what we're dealing with. It could be 5, 10, 15, 20 times the number of patients in our area and nationwide that have the infection. We just don't know.
So if people who are watching this want to reach out to you, if you happen to be anywhere near Greenwich, Connecticut, so are you licensed to Zoom with patients around the country? How can people who are listening get to you?
We run a concierge practice, so that means our patients pay a yearly fee to see us, and many of them have been with me for 18 years. And what we've said to them is that the testing that we're able to do, we do on the patients that we currently have in our practice. So for someone that's watching here, absolutely, you can reach out to me anytime you'd like. I'd be happy to chat with you.
What is that? How do they reach out? What is Greenwich?
There are two ways to reach out. The phone number is 203-531-1808, or they can go to our website, which is GlenvilleMedicalConciergeCare.com. If you just typed in Glenville Medical, you'd find us.
Okay,
excellent. But in terms of getting access to testing, it really is just for the people that are in our practice at the moment. We have other testing sites locally that can take patients as well, and we can refer people, and I've done that also, who are not my patients or friends or family that ask me these questions. I'm just here to educate, and that's why I love the fact that you've given me an opportunity to have a platform to do that.
No, this has been very helpful. This is Dr. Jeff Puglisi. He's a concierge doctor talking about COVID. He's in Greenwich, Connecticut. and please reach out to him. And Jeff, I would say let's have this conversation again in a week and see if more tests are available.
I look forward to it.
Final, just here we are, whether people are in Australia or South Africa or America or Dubai watching this, final thoughts or Israel for that matter.
Sure.
Just, what would you like to tell us all right now?
There are two messages, and one of them is to stay home and stay safe, which is what you're hearing from everyone. But there's another message of optimism that I have, that I share with many of my friends and family and patients, which is there is a generation of young people that's watching what's going on. And don't kid yourself, they're watching intently. They might not be getting as sick as some of the older individuals, but they're going to go into the healthcare services like you've never seen before, going into medicine, going into research, going into epidemiology, becoming nurses, etc. They're going to protect this country, this planet better than any of us ever have. They're going to treat each other better and kinder. And I think we're going to prevent this from ever happening again. So to me, I'm optimistic about the future. We have to get through this very tumultuous time now. But truthfully, I can't wait to see what a few years and a decade from now brings.
Thank you to Dr. Jeff Puglisi, concierge doctor out of Greenwich, Connecticut, sharing with us some things and certainly some insights that I was not aware of. So look forward to chatting to you again soon. I'm Nadia Bilchik. Please go onto my website for other interesting interviews, my YouTube channel, nadiaspeaks.com.